Cytomegalovirus, or CMV, is a common virus that many people may not have heard of. It is part of the herpes virus family, which includes other well-known viruses like chickenpox, mononucleosis, and herpes simplex. Most people get CMV at some point in their lives, but many never know they have it because it often goes unnoticed. This is because CMV often causes no symptoms in healthy individuals, making it easy to overlook. CMV is a master of disguise. It can live in the body for years without causing any noticeable illness or discomfort. The virus becomes active when the immune system is weakened, which can happen during illness, stress, or certain medical treatments like chemotherapy. Despite its stealthy nature, CMV is a significant public health concern, especially for pregnant women and people with compromised immune systems, such as the elderly or those undergoing organ transplants. In these vulnerable groups, CMV infection can have serious health consequences, including birth defects in newborns and severe illness in immunocompromised individuals. Understanding CMV, its transmission and prevention strategies is crucial for public health. This knowledge empowers individuals to protect themselves and their loved ones, ensuring better health outcomes for everyone. By spreading awareness and educating communities, we can reduce the impact of CMV and safeguard public health. In healthy individuals, CMV infection is usually silent, meaning it often goes unnoticed. They may experience no symptoms at all, though some people might have mild, flu-like symptoms that are easy to overlook. These can include fever, fatigue, sore throat, and swollen glands, which are common symptoms for many minor illnesses. However, CMV infection can be serious for certain groups, particularly those with compromised health. In people with weakened immune systems, CMV can cause severe illness, leading to significant health complications. This includes individuals with HIV/AIDS, organ transplant recipients, and those undergoing chemotherapy who are at higher risk. In these individuals, CMV can affect various organs, causing pneumonia, encephalitis, and vision problems, which can be life-threatening. CMV infection is a leading cause of hearing loss in newborns, impacting their development significantly. Pregnant women infected with CMV can pass the virus to their unborn babies, leading to congenital CMV infection, which can have serious consequences. Most babies with congenital CMV have no symptoms at birth, but some may develop hearing loss, vision impairment, or intellectual disabilities later in life, affecting their quality of life. CMV spreads through bodily fluids, including saliva, urine, blood, tears, and breast milk. The virus can also be transmitted through sexual contact and organ transplantation. CMV is most commonly spread through close personal contact, such as kissing, sharing utensils, and caring for young children. Children with CMV infection often shed the virus in their saliva and urine for months or even years. CMV can also be transmitted through blood transfusions and organ transplants, though this is less common due to screening procedures. Preventing CMV transmission requires understanding how it spreads. This knowledge is essential for protecting vulnerable individuals. Diagnosing CMV infection involves laboratory tests. Blood tests can detect antibodies to the virus, indicating past or present infection. Viral culture is another method of diagnosis, involving growing the virus from a sample of blood, urine, or other bodily fluids. However, viral culture takes longer than blood tests. In some cases, imaging studies may be used to help identify CMV-related complications in various organs. For example, a CT scan can reveal CMV pneumonia. Early diagnosis is crucial for managing CMV infection, as it allows for timely treatment and reduces the risk of complications. Section 5. Combating CMV treatment strategies and antiviral therapy. Treatment for CMV infection depends on the severity of the illness. Healthy individuals with no symptoms usually do not require treatment. For people with weakened immune systems or severe CMV disease, antiviral medications are the mainstay of treatment. These medications work by stopping the virus from replicating. Commonly used antiviral drugs for CMV include ganciclovir, valganciclovir, foscarnet, and cidofovir. Antiviral treatment can help control CMV infection. However, it cannot completely eliminate the virus from the body. The virus remains dormant and can reactivate if the immune system weakens. Section 6. Shielding the vulnerable, prevention and control measures. In this section, we will explore the essential steps to prevent and control the spread of CMV infection, particularly among those most at risk. Preventing CMV infection is crucial for maintaining public health and safeguarding vulnerable populations. This is especially important for pregnant women and people with weakened immune systems, as they are more susceptible to severe complications from CMV. Pregnant women can reduce their risk of CMV infection by washing hands frequently with soap and water, especially after changing diapers or handling children's toys. This simple yet effective measure can significantly lower the chances of transmission. Additionally, avoiding contact with saliva and urine from young children is essential, as these bodily fluids can carry the virus. Pregnant women should also refrain from sharing food, drinks, or utensils with young children to minimize the risk of infection. People with weakened immune systems should take similar precautions, including frequent hand washing and avoiding close contact with those who are ill. They should also avoid contact with anyone who is sick, as their immune systems are less capable of fighting off infections. Healthcare workers, who are on the front lines, should follow strict infection control measures to protect themselves and their patients. This includes wearing gloves and gowns when caring for patients with CMV infection, as well as adhering to all recommended hygiene protocols to prevent the spread of the virus within healthcare settings. Section 7. The importance of hygiene. A first line of defense. Good hygiene is the first line of defense against CMV infection. This includes washing hands frequently with soap and water for at least 20 seconds. Using alcohol-based hand sanitizers when soap and water are not available, avoiding touching your eyes, nose, and mouth with unwashed hands, and covering your mouth and nose when coughing or sneezing. These simple measures can significantly reduce the spread of CMV. Public health awareness campaigns can educate people about CMV. This includes its transmission, prevention, and the importance of seeking medical advice if symptoms develop. Section 8. CMV in the spotlight. Ongoing research and future directions. Research on CMV is ongoing. Scientists are working to develop a vaccine to prevent CMV infection. Several vaccine candidates are in clinical trials. These trials are evaluating the safety and effectiveness of the vaccines in different populations. Researchers are also studying new antiviral drugs to treat CMV infection. These drugs may be more effective and have fewer side effects than currently available treatments. Advances in CMV research offer hope for the future. This includes the development of effective prevention and treatment strategies. Section 9. Living with CMV, long-term implications and management. Most people with CMV infection live healthy lives. However, the virus can have long-term implications for some individuals. For example, children with congenital CMV infection may develop hearing loss or developmental delays later in life. These children may require ongoing monitoring and support. People with weakened immune systems need to be vigilant about CMV reactivation. They should report any symptoms to their doctor immediately. Regular medical checkups and monitoring are essential for managing CMV infection. This helps detect any potential complications early on. Section 10. A call to action. Raising awareness for CMV prevention. Raising awareness about CMV is crucial for public health. Educating individuals about CMV transmission, prevention, and the potential risks can empower them to protect themselves and their loved ones. Healthcare providers play a vital role in educating patients about CMV. They should provide counseling to pregnant women and people with weakened immune systems about CMV prevention strategies. Public health campaigns can use various channels to disseminate information about CMV. This includes social media, websites, and educational materials. By working together, we can increase CMV awareness and reduce the burden of this common virus. Section 11. The promise of a vaccine. Hope on the horizon. The development of a CMV vaccine is a major public health priority. A vaccine could potentially prevent congenital CMV infection and protect individuals with weakened immune systems. Scientists are making significant progress in CMV vaccine development. Several vaccine candidates are in clinical trials, and preliminary results are promising. While a CMV vaccine is not yet available, the research progress offers hope for the future. A vaccine could have a profound impact on public health by preventing the devastating consequences of CMV infection.